You've been taking that fish oil capsule every morning for years, right alongside your prescription, thinking it's only helping your heart.
There's something about that combination that most people taking both have never been told Gine, and that I want to walk you through today.
And stay with me through all three supplements, because what I'm going to show you at the end isn't just about fish oil. It's about a category of risk almost nobody monitors.
Here's the assumption most people carry about supplements, that because they're natural, they exist in a separate lane from medication. And when a supplement and a prescription share the same metabolic pathway, particularly one that cardiovascular.
From a pharmacological standpoint, that lane doesn't exist. Your liver metabolizes a supplement the same way it metabolizes a prescription, through the same enzyme systems. Your cardiologist manages your heart medications. Your prescription bottle has warnings, but nobody is required to track what you bought on the supplement aisle last Tuesday. I'm Jonathan Reed. I'm a geriatric pharmacist, and supplement drug interactions are one of the most consistent gaps I see when patients bring me their full medication list. That's the gap, and the only professional in your healthcare system trained to see across that gap, prescriptions and supplements together, is your pharmacist.
Think of your cardiovascular medications as a precisely calibrated system, like a pump running at a specific pressure, tuned over months to keep you stable.
Now introduce a compound that affects the same system, blood thinning, blood pressure, heart rhythm, 2-gub, and the calibration shifts.
I'm going to walk you through 3 supplements, in order from 3 to 1 timed, that the research consistently flags when combined with common heart-related prescriptions.
Before we begin, supplement interactions can vary significantly by individual. Everything here is educational. Please consult your fighter.
And when we reach number 1, I'm going to show you why catching any of these requires looking at something most seniors have never been asked to bring to one appointment.
Number 3, omega-3 fish oil, one of the most commonly taken supplements among adults over 60, often recommended for heart health and inflammation.
Omega-3 fatty acids work in part by affecting how your platelets aggregate, the process your blood uses to form clots. At standard doses, this effect is modest.
But when you add omega-3 to a prescription anticoagulant, a blood thinner's tome, you're combining 2 compounds that both affect the same clotting mechanism.
The anticoagulant is already calibrated to keep your blood within a specific thinning range. Omega-3 pushes in the same direction.
What I see at my counter, patients on warfarin or similar blood thinners who've been taking high-dose fish oil for months, sometimes years, without their prescriber knowing.
The signal that something is off. INR readings that have been fluctuating without any change in the prescription bio, unexplained by diet or missed doses alone.
I want to be precise here. A standard 1-gram daily dose carries lower risk than high-dose supplementation, so 3-4 grams or more per day.
Let me walk you through an illustrative scenario. Let's call him Thomas Fio, 73, retired engineer, on warfarin for a heart valve condition.
Thomas started taking high-dose fish oil after a friend recommended it for joint inflammation. He didn't mention it to his cardiologist. He didn't think of it as a medication. If you're on a blood thinner and you take omega-3, bring both to your pharmacist. Ask, given my anticoagulant, is my current omega-3 dose worth reviewing?
Number 2 involves a supplement that cardiologists actually recommend far, and the interaction with heart medications is one of the most consistently underreported.
Number 2, coenzyme Q10-tel, CoQ10-tel, a supplement widely used by seniors for energy, muscle function, and cardiovascular support.
Here's where it gets technically complex. CoQ10 also has mild blood pressure lowering properties. In a patient already on antihypertensive,
both the antihypertensive and CoQ10 affect vascular resistance, the pressure your arteries exert. When both reduce it, blood pressure can drop lower than intended.
What this looks like clinically, a patient whose blood pressure is well controlled, who starts CoQ10. There's also a documented interaction between CoQ10 and anticoagulants like warfarin. CoQ10 may affect how warfarin is metabolized.
If warfarin's effectiveness is reduced, the therapeutic protection it provides against stroke or clot may be quietly diminished. Let me walk you through an illustrative scenario. Let's call him Frank Tai, 68, retired accountant, on a statin, a blood pressure medication, and warfarin. Frank's cardiologist recommended CoQ10 to offset the statin's effect on his energy. What nobody calculated.
Frank started feeling lightheaded in the mornings. He assumed it was age. His INR had drifted out of range. His pharmacist caught both issues in one review. If you take CoQ10 alongside any blood pressure or anticoagulant medication, ask your pharmacist, is there a timing protocol I should follow for these together? CoQ10 is a legitimate supplement with real benefits. The interaction isn't a reason to avoid it. And now we're at number 1. This is the one most people have never heard of, Jarl, even though it has been used as a cardiac remedy for centuries. And the interaction is direct.
Number 1, Hawthorn Down, a botanical supplement sold in most health food stores and pharmacies, widely marketed for heart health, blood pressure support, and circulation. At sufficient doses, hawthorn can lower blood pressure, slow heart rate, and increase the heart's sensitivity to certain signals.
The interaction with digoxin, a medication prescribed for heart failure and arrhythmia, is particularly significant.
Digoxin has what pharmacologists call a narrow therapeutic window. The margin between a therapeutic dose and a problematic one is small. Hawthorn can shift you in that margin.
Hawthorn also compounds the effect of blood pressure medications, particularly ACE inhibitors and beta blockers, potentially dropping blood pressure lower than the prescription alone would. The intention is good. That's exactly what makes this interaction so easy to miss. Nobody thinks to flag the supplement that someone is taking specifically for their heart.
Let me walk you through an illustrative scenario. Let's call her Beverly Ty, 71, retired nurse, manages heart failure with digoxin and a beta blocker.
Beverly started taking Hawthorn after reading about its traditional use for cardiac support. As a former nurse, she felt informed.
Over 6 weeks, she noticed her heart rate had slowed more than usual and her energy had dropped. She assumed her condition was progressing. If you take any supplement marketed for heart health alongside any cardiac prescription, the question is simple. Is this supplement safe given my specific medication list? Hawthorn has a long history of use for a reason. It has real cardiac activity. That activity is exactly why it belongs in a managed conversation, not in a separate mental category.
Each one affects a cardiovascular pathway. Each one is sold without a prescription. And each one is being combined with cardiac medications by millions of seniors right now.
In none of the 3 cases, omega-3, CoQ10, Hawthorn is the supplement in your prescriber's system. Research consistently suggests that a substantial portion of seniors taking prescription cardiac medications are also taking supplements.
What happens to your heart when you mix these supplements with your prescription? Not always something dramatic, Hav. Usually something quiet, gradual, and entirely reviewable. If you are taking any supplement alongside any cardiac medication, and you've never had a pharmacist review both together calm, that review is the most useful thing I can point you toward. A comprehensive medication and supplement review is a structured conversation. You bring every prescription, every OTC, every supplement. For cardiac medications specifically, your pharmacist looks for pathway overlap. Do any of your supplements affect the same cardiovascular mechanisms as your prescriptions? Most pharmacies offer this at no cost. You walk in, ask for a full medication review, and bring everything how, including the bottles from your supplement cabinet. I name your cardiac medications. I also take these supplements. Can you tell me if any of these combinations are worth discussing with my cardiologist?
Your pharmacist has access to the same interaction databases your cardiologist uses, but with the time to actually sit down and run every combination against your full list.
You now know something most people taking supplements alongside cardiac medications don't, that the supplement aisle and the prescription counter aren't 2 separate pharmacological universes. That knowledge doesn't require changing anything today. It requires one conversation, Tauf, with your pharmacist, with your full supplement and medication list in front of you. And if you know someone who takes supplements for heart health alongside a prescription, a spouse, a sibling, a neighbor, this is the kind of video worth passing along.
Omega-3 affects clotting. CoQ10 affects blood pressure and anticoagulant metabolism.
The question isn't, is this supplement safe in the abstract? The question is this supplement safe given my specific cardiovascular medication list? That's a different question. The solution isn't avoiding supplements. It's including them in the same managed conversation where your prescriptions already live. One list, one pharmacist, one review. Everything I've shared today is educational. I'm not your pharmacist, and nothing here is a recommendation to stop, start, or change any medication or supplement. Supplement interactions can vary significantly by individual. Always consult your pharmacist or healthcare provider before making any changes. The goal is always the same. You leave knowing more than when you arrived. And what you do with that knowledge is a conversation worth having with the right professional.
It involves a medication taken by nearly half of all seniors PO, and a pattern in how it's being combined with something from the OTC aisle that almost nobody flags.
Next time, I want to walk you through something that comes up constantly in my practice, a specific combination that most seniors using it have never discussed with their pharmacist. If you found this useful, subscribe. I publish a new video every few days, each one built around something I see at the pharmacy counter every single week. You now know something most people your age don't, and that knowledge gives you the power to ask a better question, Bod, starting with your next pharmacy visit. I'll see you in the next one.